And I'm Parker Machado, and this is my Psych final presentation. So, in my presentation, I'm going to be covering Chapter 12, Social Psychology, Chapter 14, Stress and Health, and Chapter 15, Psychological Disorders. So, summary for Chapter 12 is there are two types of communication, there's intrapersonal and there's interpersonal. Intrapersonal is emotions, attitudes, yourself, and cognitions. Then interpersonal is helping, aggression, prejudice, attraction, and group processes. We also play a social role in society, which is a pattern or behavior of a person that is expected in a certain setting or group. Then there's situationism and dispositionism. Situationism is a belief that our behavior is determined by our immediate environment, and dispositionism is a belief that our behavior is determined by internal factors. So, two important things that we learn in chapter 12 is fundamental attribution error and cognitive dissonance. Fundamental attribution error is overemphasizing internal factors as explanations for behavior and underestimating situational factors. So, an example of this is thinking a server at a restaurant is an angry person when in reality, they've just been under a lot of pressure at work. Then, cognitive dissonance is psychological discomfort coming from holding two inconsistent attitudes, behaviors, or cognitions. So, then an example of this would be having a strong dislike for someone, but when you see them in public, you're always acting really friendly towards them. So, we learn about three kind of very important experiments in social psychology. And the first one is the Stanford Prison Experiment. So in this experiment, it's a mock prison experiment where college students would play the role as guards and prisoners. In the end, the experiment was cut short due to the guards abusing their power and the prisoners were showing signs of distress. So this experiment really just demonstrated the power of social norms, and the guards were degrading the prisoners, they were abusing their power, and they felt superior. And the prisoners showed anxiety and learned helplessness. And the experiment received a lot of controversy because of how badly some of the prisoners felt after this. So the next experiment we learned about was Ash's experiment. So in this one, there were participants and they would take place in a test with lines. So they were also surrounded by fake participants, and the fake participants would just say the wrong answer on purpose to try to get the actual participants to conform. So then when they say the wrong answer, a lot of the time the actual participants would conform to saying the wrong answer just to fit in with the group, even though they knew obviously which line was the longest line. So, just basically in this experiment, it showed conformity, which is a change in a person's behavior to go along with the group, even if he doesn't agree with the group. And then the greater the majority in the experiment meant the more likely someone was to conform. So, the final kind of important experiment that we learned about in chapter 12 was the Milgram's experiment. So, in this, there'd be two participants. One would administer a test, the teacher, and the other would take the test, the learner. If the learner got a wrong answer, the teacher would give him a shock. And the test taker was fake, so the learner was fake. And they would intentionally give wrong answers just to try to see if the teacher would shock them. And then there'd be a man in a lab coat there, and they would push the teacher to administer the shock, even if the learner begged him not to. So the learner wasn't actually getting hurt in this. They were just acting to see how far the teacher would take it before they stopped. And in this experiment, it showed obedience, which is the change in an individual's behavior to comply with an authority figure. And even when the learner would go unresponsive, 2 out of 3 participants would administer shocks, just showing that even when you know something's wrong, if there's a person that shows obedience, you're prone to follow them. So in chapter 14, we learn about stress and health. And the summary for this chapter is stress, and it has many different definitions. but it's a term to describe many unpleasant feelings. Like example of this is being overwhelmed. So there's eustress and distress. Eustress is good stress, and it can be positive and motivate us to do things. But then distress is bad stress, and that can cause burnout and illness and other stuff like that. So stress can provoke things like psychological accelerated heart rate, headaches, and stuff like that. It can evoke cognitive problems like problems concentrating or decision making. And then it can evoke behavioral problems as well, which is stuff like drinking and smoking to cope with the stress you're under. We also learned about health psychology, and health psychology is just basically the subfield of psychology devoted to health, illness, and response to being ill. So, in health psychology, psychologists try to figure out things like life choices that people make, stress causing illness, and the effectiveness of treatment, and then more. So, things like sex, age, and race all can play a role in stress levels. And it's been studied that women on average are more stressed compared to men. People who are retired usually report the lowest levels of stress out of all the groups, regardless of gender. So we also learn about the nervous system and the HPA axis. So the sympathetic nervous system is a system that triggers arousal in response to stress, and it releases adrenaline. And then this leads directly into your fight or flight response. So this arousal prepares a person to either fight or flee from a perceived threat. So like if you're being confronted by someone, your kind of body is telling you either to fight or to flee. Then the HPA axis is stress causes the hypothalamus to activate the pituitary gland, which activates the adrenaline glands, which leads to the release of cortisol. And then cortisol is a stress hormone that helps provide a boost of energy. And it's good for like threatening situations. But then when you have too much cortisol, it leads to feelings of burnout and it can weaken your immune system. So we also learned about the causes of stress in this chapter. And there are chronic stressors, which is a stressful event that takes place over an extended period of time. And then there are also acute stressors, which are brief events that may continue to be stressful even after they've ended. Then other things that can contribute to stress are traumatic events, things like military combat, losing a loved one, or childhood abuse. And these things can lead to PTSD, post-traumatic stress disorder. So then other things that can lead to stress are big life changes, such as like moving or losing a loved one. And then even smaller things like daily hassles can build up and affect mood, causing more stress. So that's things like driving to work or having to deal with traffic or stuff like that. And then lastly, in chapter 14, we learned about the effects of stress. So psychophysiological disorders are disorders whose symptoms are brought out or worsened from stress. So this can be things like headaches and acne. When you're under a lot of stress, you'll be prone to get more of these things. Then stress can harm the immune system by causing immune system errors and just overall weakening the immune system. Then stress can shorten telomeres, which block cell division, and that leads to the growth of new cells, and that leads to rapid aging. So stress can cause you to age. Then stress can also cause cardiovascular disorders like heart disease because stress and negative affectivity are linked to hypertension, which causes a lot of heart problems. And then in chapter 15, which is psychological disorders, we learn about what a psychological disorder is. It's a condition characterized by abnormal thoughts, feelings, or behaviors, but this must cause distress or impairment. So you must be like damaged by the disorder for it to be considered a disorder. Then there are a lot of different definitions for psychological disorders, and the APA definition is A psychological disorder is a condition that consists of significant disturbances in thoughts, feelings, and behaviors. And then things like violating a cultural expectation does not equal a disorder because many cultures have different social norms. An example of this is hallucinations. In Western culture, like here in America, hallucinations can be seen as like not a social norm and it violates a cultural expectation. But in Eastern countries, hallucinations aren't seen as violating cultural expectations and can be considered normal. And we also learn about psychopathology, which is the study of psychological disorders, including their symptoms, causes, and treatment. So, for diagnosis of psychological disorders, it's appropriately identifying and labeling a set of defined symptoms. Um, Something that a lot of psychologists use, and it's most commonly used by them, is the DSM-5, which is a diagnostic and statistical manual of mental disorders. And this book really just consists of things like diagnostic features, which is just the overview of the disorder, diagnostic criteria, which are the symptoms required for diagnosis, the prevalence of the disorder, which is the percent of the population that's affected by it, and then the risk factors of the disorder. So, a major psychological disorder is anxiety, and anxiety is apprehension, avoidance, or caution regarding a potential threat or danger, and it motivates us to take action. Now, anxiety and fear are different because fear is an instantaneous reaction to a threat, where anxiety can kind of build up before the threat's even there. Then, anxiety disorders are excessive and persistent anxiety, and by related disturbances in behavior. And it's estimated that around 25 to 30% of the US population go through an anxiety disorder in their lifetime. And then anxiety is more common in women than it is in men. So, another psychological disorder is phobia. And phobia is just the excessive fear or anxiety about a specific object or situation. And then the person can know that their fear is irrational, but will still go to great lengths to try to avoid it. So there are many different types of phobia, but kind of the major ones are acrophobia, which is fear of heights, which is something I have. There's aerophobia, fear of flying, so that people will be afraid to get on planes or just high off the ground. And then there's arachnophobia, which is the fear of spiders. And there's claustrophobia, which is the fear of enclosed spaces. So, three major learning pathways for phobia are classical conditioning. So, for example, a child is bitten by a dog, they then associate all dogs with that sense of being bitten, and then they're afraid of dogs. There's vicarious learning, where you could see someone else who's being afraid of dogs and staying away from them, and then you in turn also associate dogs as being something scary. There's verbal transmission of information, and that could be someone telling you dogs are dangerous, so you're just instantly afraid of them. Two important disorders that stood out to me are OCD and schizophrenia. OCD is obsession compulsion disorder, and it's thoughts and urges that are unwanted. Those are obsessions, along with the need to engage in repetitive behaviors, which are compulsions. So, obsessions are doubts, order, symmetry, aggressive and lustful urges. Compulsions are not performed out of pleasure, and the person knows it's irrational but still has to do them. So, really common compulsions are hand washing and making sure doors are locked. Then, schizophrenia, there are positive and negative symptoms. Positive symptoms include things like hallucinations, delusions, and disorganized thinking. And then the negative symptoms are things like reduced emotional expression, reduced speech output, and lack of motivation. And that's the end of my video. Thank you for watching.